I'm Dr. Michael Somenek, and today I'm going to speak to you about rhinoplasty recovery. So many people will come in asking great questions about what to expect after a rhinoplasty. I tell them that, for one, you're going to have a cast on your nose for 1 week. It achieves two things. One, it kind of protects your nose in your recovery in case you bump it and prevents anything from shifting during that first week. And secondly, it actually helps to reduce the overall swelling. Swelling is one thing that I really speak to my patients extensively about in their recovery because it can vary from individual to individual. Some people with very thin nasal skin will have less swelling in comparison to someone with an ethnic nose, like African American or Hispanic noses, that traditionally have a thicker skin envelope. That doesn't mean that you're not going to get to the result that you want, but it may take longer to get there because you need to allow the swelling, mostly in the nasal tip, to contract. Now, also people will ask how painful is the procedure, and I liken it to having a very dull headache for several days, which you give you pain medication for throughout the process, and it sort of becomes just a little bit more annoying during the recovery because your breathing isn't as good as it used to be, initially because of the congestion and the swelling that you have from the procedure. But once the cast comes off, your breathing improves, you can really appreciate the overall improvement to the aesthetic of the nose, full well knowing that rhinoplasty is a journey and it's going to take some time to get to your final result.